35,000 feet above the Atlantic Ocean, the president clutches the armrest of his seat as he gasps for air. His breath comes in shallow, rapid bursts, each inhalation more desperate than the last. His face turns ashen, lips tinged with blue. The medical team that should be on standby is nowhere to be found. The urgency of the president's emergency meeting in Lisbon had thrown the entire schedule into chaos. Security protocols were rushed and medical preparations overlooked. Now, with the most powerful man in America fighting for his life, those oversights have become deadly. The crew calls for a doctor. Silence fills the cabin. Then, from the back of the plane, a young black man stands up. Malik Ford, 24 years old, presidential escort, unnoticed by the first-class passengers just moments before. But as the president's breathing becomes more labored, Malik steps forward with steady confidence. "Let me try." Confused murmurs ripple through the cabin. A bodyguard? What could he possibly know about saving lives? What they don't know is that Malik Ford isn't just trained in protection. He spent years watching his mother, Irene Ford, battle heart failure and pulmonary embolism. He's learned every symptom, every treatment, every life-saving technique out of necessity. And right now, he's about to use that knowledge to save the president's life and change both their futures forever. The flight attendants exchange uncertain glances as Malik steps forward, his calm presence cutting through the chaos. The president's lips are turning a deeper shade of blue. "We need oxygen now," Malik says, his voice steady and authoritative. "And aspirin. This looks like a pulmonary embolism, a clot in his lungs. Every second counts." The senior flight attendant hesitates. Protocol says only licensed medical professionals should handle emergencies. But as she watches the president's chest rise and fall in desperate, shallow gasps, protocol becomes meaningless. "Get the medical kit," she tells her colleague. Malik moves with practiced precision. He's done this before, not for a president, but for the woman who raised him. His hands are steady as he adjusts the oxygen mask over the president's face. "Sir, I need you to focus on my voice," Malik says softly. "Breathe with me, slow and deep. In through your nose, hold it, then out through your mouth." The president's eyes flutter, struggling to focus on Malik's face. Around them, the cabin has gone completely silent. Passengers crane their necks, watching this young man take control of a crisis that could reshape American history. "Aspirin," Malik says as the flight attendant returns. He crushes the tablet between his fingers. Under his tongue, it'll absorb faster into his bloodstream. Working quickly, he elevates the president's legs with pillows, loosens his tie, and monitors his pulse. These are the same steps he performed countless nights when his mother couldn't breathe, when 911 seemed too far away. 20 minutes pass. The president's color slowly returns. His breathing, while still labored, becomes more regular. "He's stabilizing," Malik announces, though his voice remains cautious. "But this is temporary. We need an emergency landing and a trauma team waiting." The clot could shift. The flight attendants nod, their initial skepticism replaced by complete trust. They've just witnessed something extraordinary, not just medical intervention, but leadership under impossible pressure. If you're enjoying this story, kindly do us a favor and subscribe to our channel. It is free and won't cost anything, but it means the world to us. We are just a small channel trying to grow. And do not forget to comment where you're watching from. Thank you, and back to our video. As the plane banks toward Lisbon, Malik keeps his eyes on the president's vital signs. The steady rise and fall of his chest, the slowly improving color in his cheeks. His thoughts drift to his mother, all those sleepless nights by her bedside, learning to read the subtle signs of distress, teaching himself to be her lifeline when the healthcare system failed her. Tonight, those hard-earned skills just saved the most powerful man in America. The plane touches down with emergency vehicles already positioned across the tarmac. Flashing red and blue lights cut through the Portuguese darkness as paramedics rush aboard. Malik steps back, letting the professionals take over, but his trained eyes continue monitoring the president's condition. Within minutes, the president is transferred to a stretcher and rushed to Hospital de Santa Maria. Malik follows in the motorcade, his mind still processing what just happened. He'd acted on pure instinct, but now, in the aftermath, he can feel the weight of this moment settling on his shoulders. 3 hours later, Malik sits in the sterile hospital waiting room, still wearing his wrinkled suit from the flight. The adrenaline has worn off, leaving him exhausted but alert. Secret Service agents pace the corridors while doctors move in and out of the president's room with updates. Elena Caldwell, the president's chief of staff, approaches with relief written across her tired face. "The president is asking for you," she says, her voice carrying a mix of gratitude and something else. Curiosity, perhaps even respect. Malik's pulse quickens. He's protected the president for 2 years, but their interactions have always been professional, distant. This feels different. The hospital room is quiet except for the soft beeping of monitors. The president sits propped up in bed, his color mostly returned but exhaustion evident in his eyes. When he sees Malik, something shifts in his expression, a recognition that goes beyond their typical professional relationship. "Malik," the president says, his voice still hoarse but steady. "You saved my life today." Malik stands at the foot of the bed, unsure how to respond. "I just did what needed to be done, sir." The president studies him carefully. "No, it was more than that. You knew exactly what you were doing up there. That wasn't luck or basic first aid training." He pauses. "Tell me how you knew." The question hangs in the air. Malik shifts uncomfortably. He's never talked about his mother with anyone from work. "My mother," Malik begins quietly. "Irene Ford. She's been fighting heart failure for years. Last winter, she had a pulmonary embolism just like yours. It nearly killed her." The president leans forward slightly, his full attention focused on Malik's words. "The ambulance took 45 minutes to reach our neighborhood. By the time they arrived, I'd already started treatment myself. I had to learn everything. The symptoms, the medications, what to do when she couldn't breathe." Malik's voice grows steadier. "I couldn't just watch her die while waiting for help that might not come." The room falls silent, the weight of Malik's words settling between them. The president stares at his hands for a long moment before looking up. "I didn't know," he says quietly, his voice heavy with something that sounds like shame. "Here I am, complaining about the pressures of this job, and you've been carrying that kind of responsibility since you were what, barely out of high school?" Malik doesn't answer. He's learned that some truths don't need confirmation. The president's expression shifts as the full picture becomes clear. "Your mother is fortunate to have you. And after today," he pauses, his voice catching slightly, "I realize I'm fortunate to have you too." "I didn't do it for recognition, sir," Malik says, his tone respectful but firm. "I just saw someone who needed help. I know that." The president's voice grows more serious. "But Malik, what you did today, it goes beyond duty, beyond training. You risked everything to save my life based on knowledge you gained watching your mother fight for hers." The silence stretches as both men process the magnitude of that statement. "I want to help you," the president continues, leaning forward. "Not because I feel obligated, but because you've shown me something I haven't seen in years in this position, genuine selflessness." He pauses. "I can arrange the best cardiac specialists for your mother. Private care, experimental treatments, whatever she needs. No cost, no questions asked." Malik's chest tightens. For years, he's watched his mother ration her medications, skip appointments because of cost, suffer in silence because quality healthcare felt like a luxury they couldn't afford. The president is offering to end all of that with a single phone call. But something holds him back. "Sir, I appreciate what you're offering more than you could know," Malik says, his voice steady but carrying weight. "But helping just my mother, that's not enough." The president's eyebrows raise slightly. This isn't the response he expected. Malik takes a breath, knowing this moment will define everything that comes next. My mother isn't unique, sir. She's one of millions of Americans who ration insulin, skip cardiac appointments, choose between medication and rent. His voice grows stronger. In my neighborhood, people die from treatable conditions because the nearest hospital is 45 minutes away and they can't afford the ambulance ride. The president leans back, his expression shifting from generous benefactor to something more serious. A leader beginning to grasp the scope of a problem he's never truly seen. I've watched my mother choose between her heart medication and groceries. Malik continues, his composure starting to crack. I've sat in emergency room waiting areas with families who've been there for 8 hours because it's the only healthcare they can access. I've seen diabetic kids go into comas because their parents couldn't afford their insulin. The president's face grows pale. These aren't statistics from policy briefings. These are stories from someone who's lived them. Sir, what I want isn't charity for my family. What I want is for you to see what I see every day. Malik's voice becomes urgent, passionate. The system isn't broken. It's working exactly as designed. For people with money, with insurance, with connections. But for everyone else. He stops, his emotions catching up with him. My mother taught me that saving one life matters, but changing a system saves thousands. The president sits in complete silence, his hands folded in his lap. When he finally speaks, his voice is barely above a whisper. How many people like your mother are out there, Malik? In my zip code alone? Thousands, sir. Across the country? Millions. The president closes his eyes for a moment. When he opens them again, there are tears forming at the edges. I had no idea, he says, his voice breaking slightly. In all my briefings, all my healthcare policy meetings, no one ever told me stories like this. Malik watches as the most powerful man in America begins to understand the weight of what he's never seen. The room falls silent. The president stares at Malik, but his eyes seem to be seeing something far beyond this hospital room. Neighborhoods he's never visited, families he's never met, struggles he's never witnessed. When he finally speaks, his voice is thick with emotion. Malik, in 4 years as president, I've signed healthcare legislation, approved billions in medical research funding, met with pharmaceutical executives and insurance lobbyists. He pauses, his hands trembling slightly. But I've never once sat in a waiting room with a mother choosing between her child's asthma inhaler and next month's rent. A tear rolls down the president's cheek. I've never watched someone ration heart medication because they can't afford the full prescription. I've never seen a diabetic teenager collapse because insulin costs more than their family's entire paycheck. Malik stands quietly, recognizing this moment for what it is. A powerful man finally seeing past the policy papers and statistics to the human cost of systemic failure. You're not asking for charity, are you? The president says, his voice barely steady. You're asking me to see what I've been blind to. You're asking me to lead. Yes, sir, Malik replies simply. The president wipes his eyes and leans forward, his entire demeanor transformed. Then that's exactly what we're going to do. Not a band-aid solution, not a photo opportunity, but real, lasting change. He stands up, extending his hand to Malik. I want you by my side for this. Not as my bodyguard, but as my partner. You know these communities, you understand what they need. Help me build something that actually works. Malik grips the president's hand, feeling the weight of possibility and responsibility settling on his shoulders. When we get back to Washington, the president continues, we're going to create the largest federal community health initiative this country has ever seen. Clinics in underserved areas, mobile medical units, pharmaceutical cost regulation, transportation programs. His voice grows stronger with each word. And it's going to be led by someone who actually understands what we're fighting for. For the first time since the plane, Malik allows himself to smile. My mother always said that saving one life matters, but changing a system saves generations. Then let's change the system, Malik. Together. Malik, you've earned more than my gratitude today. The president says, his voice steady with newfound conviction. You've earned the right to lead this fight, and I'll be there to support you every step of the way. Malik looks at this man who, just hours ago, was gasping for air at 35,000 feet. Now he's offering to reshape American healthcare policy based on a conversation that started with a medical emergency and became something much more profound. Sir, I don't know if I'm ready for something this big, Malik admits. Nobody ever is, the president replies. But you're the first person who's shown me what we're really fighting for. Not poll numbers or approval ratings, but actual lives. Real families. Malik nods slowly, understanding that this moment will define not just his future, but potentially the futures of millions of Americans struggling with the same system that nearly failed his mother. When do we start? Malik asks. The president smiles, the first genuine smile Malik has seen from him. We already have. As Malik walks out of the hospital room, his mind races with possibilities. 6 hours ago, he was a presidential escort whose biggest worry was his mother's next cardiology appointment. Now he's been asked to help transform the entire American healthcare system. He thinks about his mother, Irene, probably watching the news coverage of the president's emergency landing, worried sick about whether her son is safe. She has no idea that her years of struggle, her quiet strength in the face of an indifferent system, have just become the foundation for something that could help millions of people like her. The road ahead won't be easy. There will be political opposition, bureaucratic obstacles, and skeptics who doubt whether real change is possible. But for the first time in his life, Malik Ford believes that the system that failed his family might actually be fixable. And he's going to be the one to help fix it. 18 months later, the mobile health clinic pulls up to the East Baltimore Community Center just as the morning sun breaks through the clouds. The sleek white vehicle bears the logo of the Ford Presidential Health Initiative, named not for any politician, but for Irene Ford, the woman whose struggle sparked a national transformation. Malik steps out of the passenger seat, now wearing a Navy suit instead of his old Secret Service uniform. At 26, he carries himself differently, still calm and focused, but with the confidence of someone who's seen policy become reality, who's watched abstract ideas save actual lives. Clinic's opening in 10 minutes, calls Dr. Sarah Chun, the initiative's lead physician, as she unlocks the mobile unit side panels. Within moments, the vehicle transforms into a fully equipped medical facility, complete with diagnostic equipment, a pharmacy, and telemedicine capabilities connecting to specialists across the country. A line is already forming outside the community center. Elderly residents, young mothers with children, working adults who can't afford to miss another day of work for a doctor's appointment that might cost them their job. Mrs. Rosa Martinez, 73, is first in line. She's been waiting for a cardiology consultation for 8 months through the traditional system. Today, she'll see a specialist via video link and receive her prescribed medications at no cost. Mr. Ford? She calls out as Malik walks past. Is it true what they say? That you really saved the president's life? Malik pauses, smiling gently. Mrs. Martinez, the president and I saved each other. But more importantly, we're here to save something bigger. As the clinic doors open and the day's first patients begin receiving care, Malik's phone buzzes with a text from his mother. Watching the news coverage. So proud of you, baby. Cardiology appointment went great today, clean bill of health. Love you. He smiles, thinking about how different things are now. His mother has a dedicated care team, regular checkups, and access to medications that once seemed impossibly expensive. But she's just one of thousands who now receive the same level of care through the initiative's 200 mobile clinics and 50 permanent community health centers across the country. Ready for the big meeting? Dr. Chun asks, joining him as they watch the morning's first success stories unfold. Today isn't just another clinic day. Today, the president is coming to see the initiative in action and to announce the next phase of expansion. 2 hours later, a familiar black motorcade pulls up to the community center. But this time, the president doesn't emerge surrounded by the usual wall of security. Instead, he walks directly to the clinic entrance, stopping to shake hands with patients waiting in line. "Mr. President," Mrs. Martinez calls out, clutching her new prescription bottles. "This young man of yours, he's an angel. First real doctor I've seen in 2 years. And my heart medicine don't cost me nothing now." The president's eyes find Malik across the crowd. They share a look that speaks to everything that's changed since that terrifying flight over the Atlantic. "Mrs. Martinez," the president says, taking her weathered hands in his. "Malik taught me something important. Sometimes the people who need the most help are the ones we see the least. That's not going to be true anymore." Inside the mobile clinic, the president watches Dr. Chan conduct a telemedicine consultation with a 10-year-old diabetic boy in rural Montana. The child's mother had driven 4 hours to reach the nearest specialist before the initiative launched. Now, that same specialist appears on screen in their local community center, adjusting the boy's insulin regimen in real time. "This is incredible," the president murmurs to Malik. "But tell me the real numbers. How many people are we actually reaching?" Malik pulls out a tablet, scrolling through data that would have seemed impossible just 18 months ago. Last month alone, 47,000 patient visits across all our locations. Average wait time for specialist consultations, 12 days, down from 4 months. Prescription drug costs reduced by 78% for enrolled families. He pauses on a particular statistic. "But here's the number that matters most to me. Preventable deaths in our target communities are down 31%. That's 2,400 people who are alive today because they had access to care when they needed it." The president's voice catches slightly. 2,400 people. Mothers who didn't die from undiagnosed heart conditions. Diabetics who didn't go into comas from rationing insulin. Kids who didn't develop permanent lung damage from untreated asthma. Malik's voice grows stronger. People like my mother, who now have hope instead of just survival. A commotion outside draws their attention. Through the window, they see Elena Caldwell, the president's chief of staff, speaking urgently into her phone while gesturing toward the motorcade. "Sir," she calls, entering the clinic. "We need to leave for the airport. The healthcare committee vote has been moved up." The president turns to Malik with a grin. "Ready to make this permanent?" Congress is voting on the Ford Initiative Expansion Act today. Full federal funding, nationwide implementation. Malik's heart races. They've proven the model works, but scaling it to reach every underserved community in America seemed like an impossible dream. "What are our chances?" Malik asks. "With results like these, and with you testifying before Congress." The president clasps Malik's shoulder. "I'd say we're about to change American healthcare forever." As they prepare to leave for Washington, Malik takes one last look at the mobile clinic. Mrs. Martinez waves from the pharmacy window, holding up her medications with a smile that could power the entire city. 18 months ago, he was a bodyguard who happened to know CPR. Today, he's about to help convince Congress to fund the largest healthcare expansion in American history. His phone buzzes again. Another text from his mother. "Watching C-SPAN. Go change the world, baby. I'll be cheering you on." 6 months later, Washington, D.C. The Ford Initiative Expansion Act passed Congress with overwhelming bipartisan support. What started as an emergency at 35,000 feet had become the largest healthcare transformation in American history. Malik stands in the Oval Office, no longer as a bodyguard but as the newly appointed director of community health initiatives. The president sits across from him, reviewing the latest impact reports. 1 million Americans now have access to care they couldn't afford before, the president says, setting down the document. Mobile clinics in 500 communities. Prescription drug costs cut in half nationally. And it all started because you had the courage to stand up on an airplane. Malik thinks about his mother, now thriving with her full medical team. About Mrs. Martinez, whose heart condition is completely managed. About thousands of families who no longer have to choose between medicine and groceries. You know what the best part is? Malik says, "My mother called yesterday. She's volunteering at the new Baltimore clinic, helping other families navigate the system. She says it's her way of paying forward what we built." The president smiles. Sounds like her son. A knock at the door interrupts them. Elena Caldwell enters with a familiar face. Dr. Chun, holding a tablet with breaking news. "Sir, you need to see this," Dr. Chun says, turning the screen toward them. "Portugal just announced they're implementing our model nationwide. They're calling it the Lisbon Protocol, named after where it all began." The president and Malik exchange a look that carries the weight of their entire journey. From a medical emergency over the Atlantic Ocean to a global healthcare revolution. "Mr. President," Malik says quietly, "my mother always told me that the right thing to do is rarely the easy thing to do. But sometimes, if you're brave enough to act, one moment can change everything." "For millions of people," the president replies, "that moment was when you stood up and said, 'Let me try.'" As they watch the news coverage of countries around the world adopting their community health model, Malik Ford, former presidential escort, son of Irene Ford, architect of the most significant healthcare advancement in modern history, allows himself a moment of quiet pride. He had saved the president's life. But together, they had saved something far greater. The belief that healthcare is a right, not a privilege, and that sometimes the most powerful changes begin with the simplest act of courage. If you enjoyed our story, please subscribe to our channel for more inspiring stories and don't forget to like and share.